This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, November 10th, we say good morning to Sara Donkersloot. Good morning, Sara.
Thanks for listening.
Good morning, Gary, and welcome to Wellspring, a broadcast sponsored by Spectrum Health-Zeeland Community Hospital. Stroke is the number 5 cause of death and a leading cause of disability in the United States. I am just very delighted today because I have 2 guests, Andrea Goosen, who is the Director of Clinical Nursing at Zeeland Community Hospital, and Annie Wilks, Stroke Coordinator for Zeeland Hospital. And they led a multidisciplinary team, which resulted in the hospital receiving primary stroke certification from the Joint Commission. Good morning, Andrea and Annie.
Morning.
Good morning.
So you are joining us via Zoom connection. So if anyone who's listening has a question, they can call Gary at 616-395-1450, and he will pass along the call to Annie or Andrea. So before we begin and talk about stroke, Andrea, tell us a little bit about yourself, your role and your background.
Yeah, thanks for having us. I'm the Director of Nursing here at Zeeland Community Hospital, and I've been with Spectrum Health for almost 20 years. My background is primarily in critical care nursing, and I spent the majority of my career at Butterworth and Grand Rapids. My last role in Grand Rapids was the Neuro ICU nurse manager role, and I helped lead that team through comprehensive stroke designation before transferring to Zeeland.
And Annie, what is your role?
Yeah, thank you for having us again, Sara. I am the stroke coordinator for Zeeland Hospital. I've been with Spectrum Health for about 13 years. I am a physical therapist by background and previously worked on the Neuro ICU at Butterworth Hospital with patients that have had a stroke.
So Andrea, you've had a career of nursing. What do you enjoy about your work?
Yeah, I enjoy really helping lead our organization through change and improvement. It's very rewarding. I love being an advocate and really educating and promoting awareness to our communities so that they can be their healthiest.
And I know from personal experience of working with you, you are also an advocate and support for our staff. And we appreciate the support that you give to them each and every day. So thank you very much for that, Andrea. And Annie, what do you enjoy about your work?
Yeah, I love working with our Zeeland community and Zeeland Hospital to help provide the most comprehensive care for our stroke patients, as well as providing education on stroke prevention.
So Annie, what is a stroke?
Yes. So a stroke is a medical condition in which something blocks blood supply to part of the brain, or when a blood vessel in the brain bursts.
Are there different types?
That is a very good question. There are 2 main types of stroke. The first type is an ischemic stroke, and this is when something is blocking blood flow to the brain and is the most common type of stroke. The other type of stroke is a hemorrhagic stroke, and this is when weak blood in the brain puts too much pressure on the brain cells and they become damaged.
Andrea, tell us, what are the risk factors for stroke, or who, might be someone who may get it more than another person?
Yeah, so risk factors really include smoking, having high blood pressure, AFib, which is just an irregular heart rhythm that can cause you to have clots that could shower to your brain, high cholesterol, diabetes, obesity, really lack of physical activity. Some things that can be out of your control are family history, gender, age, and race.
Andrea, so, you talk about things that are outside of, risk factors that you can't control: gender, age, race, family history. Can a person of any age have a stroke? Primarily we think that it's going to be someone of an older age.
Yes, you can have you can have a stroke at any age.
And so let's talk a little about some of the symptoms of stroke because, we know about the risk factors, but, how might someone think that they are having a stroke? Annie, you want to answer that one for us?
Absolutely. So to remember the signs and symptoms of a stroke, we use the term be fast. B stands for balance, so any sudden loss of balance or changes in coordination. E stands for eyes, so any trouble seeing out of one or both of your eyes. F is for face, any sudden drooping on one side of the face. A is for arm, any weakness in one arm or leg. And S is for speech, so any sudden trouble with speech or understanding. And lastly, T is for time, call 911 right away. So that is be fast.
So Annie, you talked about all those things, be fast, coordination, your eyes, your face, some drooping, arm weakness. Could someone just have one of those? Or is it usually multiple if somebody's having a stroke?
Yeah, that is a very good question. So sometimes it could be just one symptom. It could be just balance. Sometimes it could be just changes in speech. And sometimes it can take the form of having multiple signs and symptoms of those all at one time. So when in doubt, if you have one symptom, multiple symptoms, you want to seek medical attention as soon as possible.
So Andrea, if you see someone exhibiting those symptoms, what should you do?
Yeah, call 911. Like Annie said, always call 911. Never attempt to drive yourself to the hospital. It's really important that you have medical attention as soon as possible, and don't even have a loved one drive you. Call 911.
Well, and the thing about Andrea, when you call 911 is they're going to stay on the line with you, aren't they? They're
Yes.
going to be able to say, okay, what's happening with your loved one? They're not just going to drop you off. You're going to have that connection point so that when, the person comes in, there's a little history to be able to help, correct?
Exactly.
So, okay, Andrea, you mentioned 911 and, the acronym being FAST. Why is there a need to act so fast?
Yeah, I think Annie mentioned a little bit about that, but it's so important to act fast because time equals brain. About 32,000 brain cells die every second during an ischemic stroke. So it's really important to act fast and get to a hospital and seek medical attention as soon as possible so we can help you and your loved one.
Let me step in for a moment. Annie or Andrea, either one of you can answer this question. I have seen public service announcements dealing with people getting a stroke and the importance of it, but they call it a brain attack. Is that really a fair way of judging it? It's almost like a heart attack for the brain. That's the first analogy I have. They call it a brain attack. Can you sort of explain that?
Yeah, so the brain attack is, similar. That's exactly what is happening to the brain when you have a stroke. So oftentimes those terms, we use them interchangeably, a stroke and a brain attack. But yeah, that is what is happening to your brain. Either those cells are dying, either they are not receiving the blood flow they need, or, there is a hemorrhage and there's blood on the brain and those blood cells are dying. So yeah, that could certainly be used interchangeably.
Let me follow up, Annie or Andrea, on this. There is, of course, the stroke aspect of it. There's another thing called TTAs. Explain a little bit about the difference on that. And having TTAs, does that sort of as a precursor for a stroke, or it's just not related, or what?
Are you saying TIAs?
Yeah, I'm sorry, TIAs. I'm sorry, you're right there. Sorry, Sarah, I got the wrong letters there. Go ahead.
Go ahead, Annie.
So a TIA is, the beginning of a stroke. What happens in a TIA is that the symptoms are fully resolved, but it's still important to come seek medical attention because a lot of times a TIA, which is a transient ischemic attack, is a precursor to having, a bigger stroke.
Well, and I just want to again emphasize here is the key is, Andrea, you were saying, 32,000 brain cells die every second. And that's why somebody might say, okay, I'm just going to get him into my car and I'm going to bring him. But it's really, really important to call 911. Okay, so Annie, so somebody's called 911 I'll have you answer this one, Annie, and they present to Zeeland's ER. Talk about, what's going to happen, and, they're exhibiting some of those stroke symptoms.
Yeah, that is a good question. So when you come to Zeeland's ER with signs and symptoms of a stroke, you will be rapidly assessed by our team because we did stress the importance that time is brain. So the quicker you can get to us, the quicker we can help you be assessed by our team and come up with the appropriate plan from there. The next step may include getting a head CT, just looking at, the imaging of the brain. And then oftentimes, if you get here quickly, and that's why we say be fast, there is a medication to help stop progression of the stroke. So be fast, come to us quickly if you have any signs or symptoms of a stroke.
Andrea, Zeeland Hospital recently received primary stroke certification by the Joint Commission. And I know both of you were part of that team to be able to get on that certification. Talk about what that means.
Yeah, being a primary stroke center really means that we provide the most up-to-date and evidence-based care to our stroke patients. We use guidelines provided by the American Heart Association to help us develop our policies and procedures. And it means that we have a team of experts to care for you. And we are part of a really large system that works closely with our comprehensive stroke center in Grand Rapids. And we work with them to assess, diagnose, and treat all of our stroke patients.
And Andrea or Annie, either of you can answer this. And this was quite a team effort, wasn't it? It wasn't something that you just said, okay, you know what I mean? Today we're going to get this primary certification, and next month we'll have that. Talk a little bit about the process and really how this really is a wonderful designation to have.
Yeah, the process, like you said, it's long. We have an amazing stroke team that Grand Rapids formed and actually branched out to our regional hospitals. And so every regional hospital has a stroke coordinator now that helps them develop these policies and procedures to work with our comprehensive hub in Grand Rapids. And really just going through the process was just a really rewarding experience. It really brought us together as a system, and it's amazing to see how we can all provide the same evidence-based care now together.
Well, and for people who are maybe saying, what's the Joint Commission? That means that an agency came in and made certain that all the I's were dotted and the T's were crossed so that, we are meeting those standards. Okay, Annie, this summer the hospital received national recognition for its commitment to provide, again, high quality stroke care from the American Heart Association. Talk about that designation and that award.
Yeah, that is correct. So the American Heart Association has different awards for the different work that the stroke centers do. And we were very excited that we received something called the Silver Quality Award and a Target Stroke Honor Elite Plus. So sounds like a lot, but it is a lot. It's a lot to be celebrated. We worked really hard to get it. We were also honored for our work with type 2 diabetes as it relates to stroke. So it was great to celebrate this award, and a lot of hard work went involved so we could provide the best care for our community.
And we are out of time, but for those who are listening, if you're having a stroke, be fast. Remember what we've talked about today and know that Zeeland Community Hospital can take care of you. Until next week, Spectrum Health Zeeland Community Hospital wishes you well.